This is All India Radio. We now bring you a special news program on COVID-19. Good morning. I am Sarabjit Kaur. With me is Subhadra Ramachandran. The headlines. Nation to join Prime Minister Narendra Modi's call to light up diyas, candles at 9 p.m. today in collective resolve to fight COVID-19. Power Ministry says adequate arrangements in place to handle grid stability during the event. Government urges people to wear homemade masks when they step out of their houses. Centre makes over 50 crore poor people eligible for free COVID-19 testing and treatment under Ayushman Bharat scheme. Restrictions imposed on exports of diagnostic kits to meet domestic need. More than 1 crore individuals download Arogya Setu mobile app to assess the risk of COVID-19. The nation will today join in the Prime Minister Narendra Modi's call to switch off lights of their homes at 9 p.m. for 9 minutes and light up diyas, candles or mobile flashlights to display the nation's collective spirit to defeat coronavirus. In a video message, the Prime Minister said, "We will experience the superpower of light, clearly illuminating the common purpose we are all fighting for." He said, "Midst the darkness spread by the corona pandemic, we must continuously progress towards light and hope." Mr. Modi said, "The collective strength of 130 crore Indians is with each one of us, and it is the strength of each one of us."
रात 9 बजे घर की सभी लाइटें बंद करके घर के दरवाजे पर या बालकनी में खड़े रहकर 9 मिनट के लिए मोमबत्ती, दिया, टॉर्च या मोबाइल की फ्लैशलाइट जलाएं और उस समय यदि घर की सभी लाइटें बंद करेंगे, चारों तरफ जब हर व्यक्ति एक एक दिया जलाएगा, तब प्रकाश की उस महाशक्ति का एहसास होगा जिसमें एक ही मकसद से हम सब लड़ रहे हैं, ये उजागर होगा.
The Prime Minister urged the people to maintain social distancing, stay indoors and not form groups while lighting up lamps. He said one must never cross the Lakshman Rekha of social distancing.
इस आयोजन के समय किसी को भी कहीं पर भी इकट्ठा नहीं होना है. रास्तों में, गलियों में या मोहल्लों में नहीं जाना है. अपने घर के दरवाजे, बालकनी से ही इसे करना है. सोशल डिस्टेंसिंग की लक्ष्मण रेखा को कभी भी लांघना नहीं है. सोशल डिस्टेंसिंग को किसी भी हालत में तोड़ना नहीं है. कोरोना की चेन तोड़ने का यही रामबाण इलाज है.
Mr. Modi also said the way people paid gratitude to those fighting against COVID-19 on 22nd of last month has become a model that is being emulated by other countries. Citizens are advised not to use alcohol-based sanitizers while lighting diyas and candles today at 9 p.m. as it is inflammable. Actor Deepika Chikleya has urged people to make this evening's event a great success.
हमारे माननीय प्रधानमंत्री श्री नरेंद्र भाई मोदी ने एक वीडियो क्लिप के द्वारा हमें संदेश दिया कि इस संडे रात को 9 बजे 9 मिनट के लिए हम दीप प्रगटाएं और रोशनी करें. वो चाहे आप दिया करें या मोमबत्ती करें, लेकिन रोशनी जरूर करें. मैं जरूर करने वाली हूँ, अपने परिवार के साथ आप भी करिएगा.
The Ministry of Power has clarified that adequate arrangements and protocols are in place to handle grid stability during lights out event at 9 p.m. today. The clarification came in wake of the apprehensions that switching off lights during the period may cause instability in the grid and fluctuation in voltage which may harm the electrical appliances. The ministry said these apprehensions are misplaced. It said the Indian electricity grid is robust and stable. The appeal of the Prime Minister is to simply switch off the lights in their homes from 9 p.m. to 9:00 p.m. and there is no call to switch off either street lights or appliances like computers, TVs, refrigerators and ACs in the homes. Only lights should be switched off. Indian Council of Medical Research, ICMR, has set a fresh protocol for healthcare workers to start with rapid antibody-based blood test for COVID-19. The ICMR has framed a new strategy for areas reporting large migration gatherings and evacuee centers where large number of COVID-19 cases are arising. The top medical research body stated that cases of influenza-like illness, ILI, are to be monitored in health facilities. The advisory also mentioned that as a matter of abundant precaution, all symptomatic ILI persons should be advised home quarantine for 14 days. Indian Council of Medical Research, ICMR, has approved more than 200 laboratories for testing COVID-19 across the country currently. According to ICMR, in districts with no operational COVID-19 testing facility, setting up of a new center will be considered if the number of suspected cases is more than 100 per day and the nearest testing laboratory is over 250 kilometers away in the plains and over 150 kilometers away in hilly regions. Based on new requests from several districts for initiation of COVID-19 testing, the ICMR has come up with an advisory for setting up new laboratories. According to the advisory, a testing laboratory can be made operational in a district in case the nearest one is at the above-mentioned distance and the existing laboratories are testing at least 100 samples each per day. A total of 3,072 confirmed cases of COVID-19 have been reported in the country so far. Out of these, 212 patients have recovered and discharged from the hospitals, while 75 patients have died. Briefing media in New Delhi, Joint Secretary, Ministry of Health and Family Welfare Love Agarwal said, the cases reported in the country are much lesser than those detected in other countries. He said 9% cases are of the age group between 0 to 20 years, while 42% cases detected in the age group between 21 to 40 years, and 33% cases are related to patients between 41 to 60 years of age. Persons above 60 years of age make 17% of the total cases. Mr. Agarwal suggested to the high-risk people to follow the directive and guidelines issued by the government.
अगर हम देखें तो हमारे देश में जो केसेस का डबलिंग रेट है वो बाकी अधिकांश देशों के मुकाबले काफी कम है, लेकिन इसके साथ ही जो एक मुख्य इश्यू फिर मैं आप सबकी दृष्टि में लाना चाहूंगा कि हम एक कम्युनिकेबल डिजीज, एक इन्फेक्शियस डिजीज से डील कर रहे हैं. हमारी हर दिन की बैटल है. हम आज अगर सक्सेसफुल हैं, कल अगर कहीं पर भी कोई भी चूक होती है तो हम फिर से पुरानी परिस्थिति में आ सकते हैं, फिर से हम सक्सेस से नॉट सक्सेसफुल की कैटेगरी में आ सकते हैं.
Mr. Agarwal said that out of the total COVID-19 cases reported so far in the country, 30% of them are linked to Tablighi Jamaat cluster.
तबलीगी जमात से रिलेटेड केसेस हमें 17 स्टेट से मिले हैं. उसमें 1023 पॉजिटिव केसेस जो कि इससे लिंक पाए गए हैं एपिडेमियोलॉजिकली. अब तक हमारे देश में जो टोटल केस आए हैं उसमें से करीब 30% केस, 30% केसेस आर लिंक टू वन पर्टिकुलर प्लेस वेयर वी कुड नॉट सॉर्ट ऑफ अंडरस्टैंड इट एंड मैनेज इट.
Joint Secretary in the Home Ministry, Punya Salila Srivastava, said that the lockdown measures are being effectively implemented. On cases related to Tablighi Jamaat workers, Ms. Srivastava said, through a massive effort around Tablighi Jamaat workers and their contacts have been quarantined.
एक मैसिव एफर्ट के थ्रू लगभग 22,000 वर्कर्स और उनके कॉन्टैक्ट्स को आज की डेट में क्वारंटाइन कर दिया गया है.
The final sampling of 263 evacuees from Rome, Italy, housed at ITBP camp in New Delhi, done after 14 days of quarantine. The reports are awaited. The first batch, which arrived from Milan, Italy, of 217 members were tested negative for coronavirus after 14 days of quarantine on Friday. They include 2 members who were tested positive earlier, have recovered and tested negative. The batches have been quarantined at Indo-Tibetan Border Police, ITBP facility Chawla, since their arrival on 15th and 22nd March. At present, a total of 480 evacuees from Italy are being looked after at ITBP Chawla quarantine facility. This facility has seen more than 1,000 evacuees, including 42 foreign nationals till date, and successfully managed the wellness center since 28 January this year. During the lockdown in the wake of COVID-19, Indian Railways is offering its unhindered services of parcel trains for nationwide transportation of essential commodities and other goods required to meet the needs of citizens of the nation. Railways is already transporting essential commodities to different parts of the country through freight trains. While these freight operations of railways are meeting the needs of bulk transportation of essential, parcel trains are transporting various items that need to be delivered comparatively in smaller quantities. More from our correspondent.
Parcel trains are providing big boost to transportation of essential commodities and other goods in times of lockdown due to COVID-19. So far, Indian Railways has loaded 30 special parcel trains to various destinations all over the country. In order to ensure speedy delivery and availability of vital goods and commodities across the nation, it is also identifying routes for other areas as well. Indian Railways has also been running other parcel trains as per demand of the customers during the period of lockdown, including milk specials and food products. Besides, special parcel trains can also be planned as per the demand. Anand Kumar, AIR News, Delhi.
Vehicle Research Development Establishment VRDE Ahmednagar, which is a DRDO laboratory, has designed a full-body disinfection chamber called a PSE. This walk-through enclosure is designed for personnel decontamination. This is a portable system equipped with sanitizer and soap dispenser. The decontamination starts using a foot pedal at the entry. On entering the chamber, electrically operated pump creates a disinfectant mist of hyposodium chloride for disinfecting. The mist spray is calibrated for an operation of 25 seconds and stops automatically, indicating the completion of operation. The system consists of roof-mounted and bottom tanks with a total of 700 liters capacity. Approximately 650 personnel can pass through the chamber for disinfection until the refill is required. A Hyderabad-based biotech company is working on developing a nasal vaccine for COVID-19. An international collaboration of virologists at the University of Wisconsin-Madison and the vaccine companies FluGen, along with Bharat Biotech, has begun the development and testing of a vaccine against COVID-19 called CoroFlu. Bharat Biotech will manufacture the vaccine, conduct clinical trials, and prepare to produce almost 300 million doses of vaccine for global distribution. This is All India Radio giving you a special program on COVID-19. Let's take a look at the headlines once again. Nation to join Prime Minister Narendra Modi's call to light up diyas, candles at 9 p.m. today in collective resolve to fight COVID-19. Power Ministry says adequate arrangements in place to handle grid stability during the event. Government urges people to wear homemade masks when they step out of their homes. Centre makes over 50 crore poor people eligible for free COVID-19 testing and treatment under Ayushman Bharat scheme. Restrictions imposed on exports of diagnostic kits to meet domestic need. More than 1 crore individuals download Arogya Setu mobile app to assess the risk of COVID-19. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
गांवों के सरपंचों के लिए कोरोना वायरस कोविड-19 से जुड़ी एक आवश्यक सूचना। दूसरे राज्यों और शहरों से वापस आए लोगों को कोविड-19 के बारे में ये जानकारी अवश्य दें। आपस में 1 मीटर की दूरी बनाए रखें। नाक, मुंह या आंखें अनावश्यक न छुएं। बार बार हाथ साबुन से अच्छी तरह 20 सेकंड तक धोएं। खांसते एवं छींकते समय रुमाल या कोहनी से नाक मुंह ढकें। कोविड-19 से बचाव के लिए आशा कर्मियों से सलाह लें। अधिक जानकारी के लिए अपने जिला मजिस्ट्रेट या मुख्य जिला चिकित्सा अधिकारी से संपर्क करें या भारत सरकार के हेल्पलाइन नंबर 1075 पर कॉल करें।
Government has urged the people to wear homemade masks to keep coronavirus at bay. In an advisory, Health Ministry asked people to wear face masks, particularly when they step out of their houses. It said social distancing and personal hygiene are keys to prevent COVID-19 infections. Certain countries have claimed benefits of homemade face cover for the general public. Such homemade face cover is a good method for maintaining personal hygiene, the advisory said. Talking to media, Joint Secretary Ministry of Health and Family Welfare Love Agarwal said the use of such masks will help in protecting the community at large.
इसमें हमने ये भी कहा है कि कोई भी आदमी अपना जो ये हैंड फेस कवर है, प्रोटेक्टिव कवर है, इसको दूसरों से शेयर ना करे। अगर फैमिली में 4 मेंबर हैं और उनको चारों को यूज करना चाहते हैं तो चारों अलग अलग यूज करें। दूसरा हमने कहा है कि आप उसको मल्टीपल में बना के रखें, यानी कि अगर एक आप फेस कवर को धो रहे हैं तो दूसरा फेस कवर आप यूज करें।
Union Health Minister Dr. Harshvardhan has said that more than 50 crore poor and vulnerable citizens will be eligible for free COVID-19 testing and treatment under Ayushman Bharat Pradhan Mantri Jan Arogya Yojana PMJAY. In a tweet, Dr. Vardhan said that testing at private labs and treatment in designated hospitals has now been made free for Ayushman beneficiaries across the country. He said the private sector should act as a key partner in the fight against COVID-19 infection. Dr. Vardhan appealed to the private labs and hospitals to come forward in large numbers to become a part of this effort. More than 1 crore individuals have downloaded the Arogya Setu mobile app. Government had launched a mobile app to bring the people of the country together in a resolute fight against COVID-19. The app, called Arogya Setu, joins Digital India for the health and well-being of every Indian. The app will enable people to assess themselves the risk for their catching the coronavirus infection. It will calculate this based on their interaction with others using cutting-edge Bluetooth technology, algorithm and artificial intelligence.
Good news is coming from the crown of the country, Ladakh, as 7 patients are discharged from the hospital after they tested negative for COVID-19. They were discharged yesterday from SNN Hospital after their samples tested negative consecutively twice. 4 patients are now undergoing treatment and their health condition is stated to be stable. A report.
Saturday was historic day in fight against coronavirus in Ladakh as 7 patients were discharged from the isolation ward of SNM Hospital in Leh. They were given warm CO by doctors led by medical superintendent of the hospital, Dr. Sampel, offering traditional khataf amidst clapping of nurses and paramedics. Ladakh is one of the first to report COVID-19 cases in early March. However, Ladakh has set an example for whole country in containing the spread of this virus. Strict lockdown implementation by the administration and cooperation of people to the advisories. With Ramesh Chandra, this is Yangchen Dolma reporting from Leh, Ladakh for Air News.
In Gujarat, police traced 7 more persons yesterday who had attended the Tablighi Jamaat's religious event in Delhi last month. With this, the total number of attendees who have been identified so far is 110. All of them are from Navsari district. State DGP Shivanand Jha said their health checkup is being conducted, after which they will be quarantined. A report.
A notification issued by Ahmedabad police yesterday bans all the private 2, 3 and 4-wheelers on the roads during lockdown period. City Police Commissioner Ashish Bhatia said the vehicles providing all the essential services are exempted from the ban. In order to prevent the community transmission of COVID-19, Ahmedabad Municipal Corporation has created 5 containment clusters from where positive cases were found and quarantined all the households in the cluster. AMC is providing all the essential services to them at doorstep. City Police are using drones, CCTV to track down violators of the lockdown. The city reported 45 cases for COVID-19 so far. Aparna Khund, Air News, Ahmedabad.
In order to provide necessary trained manpower to prevent coronavirus spread, Maharashtra government will provide online training to about 1.25 lakh Ayush doctors in the state throughout the week. While addressing citizens through social media platform, Health Minister Rajesh Tope informed that necessary equipments, including about 1.5 thousand ventilators and 2.5 lakh N95 masks, are available so far. Meanwhile, 145 fresh cases of COVID-19 were registered yesterday in the state, with 6 people succumbing to the infection in the last 24 hours. With these, the total infected persons in the state stands at 635, with a total of 32. In Bihar, the number of COVID-19 cases has gone up to 32 as 1 more positive case came up yesterday. The fresh case is a 65-year-old woman who had returned from England recently. She had been kept in isolation at her residence. While 4 patients have been cured, 1 person died of coronavirus in the state so far. In Telangana, 43 persons have been tested positive for coronavirus yesterday, taking the total COVID-19 cases in the state to 272. Of them, 33 persons have fully recovered from COVID-19 and have been discharged. Presently, 228 active cases are being treated at various designated hospitals in the state. It may also be recalled that total 11 persons succumbed to COVID-19 in the state. 2 persons from Tripura who had attended the Tablighi Jamaat's Markaz in Delhi last month have tested positive, COVID-19 positive in Rajasthan. Tripura Health Secretary Debashish Basu said they are undergoing treatment at the Bikaner Government Hospital in Rajasthan.
In Madhya Pradesh, number of corona-infected people has increased to 179 after new cases reported in Indore, Bhopal and Barwani districts. So far, 11 people have died in the state. 36 patients have now fully recovered. Meanwhile, MP Board of Secondary Education has clarified that the examinations of the 10th and 12th board will take place after the lockdown is over. A report.
The board said that due to short time, it is not possible to conduct examinations in all subjects. So that exam will be conducted only those subjects which are required for admission to higher educational institutions. The system of giving marks will be set separately for the subjects which will not have examinations. The new exam date will be decided 10 days after the lockdown ends, while evaluation of answer sheets will start 3 days after the end of the lockdown. On the other hand, Bhopal District Collector Tarun Kumar Pithode informed that many senior officers have been placed under quarantine, which came in contact with J. Vijay Kumar, Director of Bhopal Health Department. Mr. Kumar had tested positive for COVID-19 yesterday. Sanjeev Sharma, AIR News, Bhopal.
In Tamil Nadu, 74 people have tested positive for the COVID-19 yesterday, taking the total to 485 cases. 2 others died of the infection yesterday. To contain the spread of the disease, the state government has tightened the norms for shopping to reduce public movement outside homes. Shops selling essential commodities have been asked to wind up by 1 p.m. every day. More from our correspondent.
As the spread is more among the single group of people who returned from the Delhi conference, the state government has asked the National Institute of Epidemiology, a research institution under the Indian Council of Medical Research in Chennai, to conduct a study on the factors responsible for it. Meanwhile, the customs officials in Chennai airport, seaport and foreign post offices in the city are working round the clock to facilitate the import of crucial medical equipment and medicines without any delay. Ventilators, defibrillators, medical gloves, masks and digital forehead thermometers are being given urgent clearance. Shipments containing critical components for the assembly of medical equipment are also being cleared on priority to keep the hospitals well equipped in their fight against the onslaught of the virus. Jai Singh, AIR News, Chennai.
In Kerala, sheet taxis come to the aid of elders and ill during the lockdown. More from our correspondent.
She Taxi will help the elderly and the ill who are facing difficulties in the wake of lockdown in Kerala. Minister K.K. Shailaja said that those who live alone and are ill and the elderly from today can make use of the She Taxi service to buy medicines and for hospital appointments. The service will be available initially in a 15-kilometer radius in Thiruvananthapuram, Kochi and Kozhikode. Those in need can call the centralized call center on 730-670-1200 and 730-670-1400. Mayusha for AR News from Thiruvananthapuram.
In the wake of the coronavirus outbreak, the government has put curbs on exports of diagnostic kits with a view to discourage shipments. The move would help in dealing with the COVID-19 crisis as these kits are required for testing of patients. Earlier, exports of these products were allowed without any restrictions. Putting them under the restricted category would mean that an exporter will now require a license from the DGFT for outbound shipments.
In our series Expert Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Dr. Anant Mohan, Head of Pulmonary Medicine AIIMS, has advised the people not to take medicine like hydroxychloroquine or anti-malaria without a prescription by a doctor.
Please do not take medicines such as azithromycin, other antibiotics, antivirals or hydroxychloroquine or other antimalarials without a proper prescription by a doctor. Do not self-medicate.
Ms. Jacinta Gunjia, Senior Nursing Officer AIIMS, has stressed on the need for social distancing.
Social distancing is a non-pharmaceutical infection prevention and control intervention to break the chain of infection.
Celebrities continued to support lockdown. They called upon people to fight corona by staying indoor and following guidelines issued by the government. Former cricketer Sunil Gavaskar said,
"Please maintain personal hygiene. Please avoid gathering in places because that is where the virus can spread and you might also catch it unknown to you. Please avoid unnecessary travel. Believe me, that's the hardest thing for me myself because I am on a plane every third or fourth day. But here I am cooped up in my house for the last 5 to 6 days. So please try and avoid unnecessary travel."
Ball singers are spreading message to fight COVID-19 in rural areas of West Bengal. Let's listen one of them. Prime Minister Narendra Modi had a telephonic conversation with Spanish Prime Minister Pedro Sanchez Perez Cafson. The two leaders discussed the global challenge posed by the COVID-19 pandemic. The Prime Minister conveyed his deepest condolences for the tragic loss of lives in Spain and offered his prayers for the speedy recovery of those still suffering from the disease. The two leaders agreed on the importance of international cooperation for fighting the global health crisis. Mr. Modi also had a telephonic conversation with Brazilian President Jair Messias Bolsonaro yesterday. The two leaders discussed the global situation in the wake of the spread of COVID-19 pandemic. He assured all possible support to Brazil President in this difficult hour. Both the leaders stressed on the significance of close cooperation between India and Brazil to mitigate the grave crisis caused by COVID-19. They agreed on the need to forge a new human-centric concept of globalization for the post-COVID world. The coronavirus pandemic has killed more than 45,000 people in Europe, around 85% of them in Italy, Spain, France and Britain. With a total of 46,033 deaths out of 6,27,203 cases, Europe is the continent hardest hit by COVID-19. Italy with 15,362 deaths and Spain with 11,744 are the two worst hit countries in terms of fatalities. France has recorded 7,560 deaths and Britain 4,313. In the United States, the number of confirmed coronavirus cases have topped 3 lakh with more than 8,100 deaths.
And now an overview of today's newspapers covering COVID-19 stories. All newspapers talk about the latest on the COVID-19, the lockdown, protective measures, and its all-pervading effect on every sphere of life. While the Hindu states 42% are patients between 21 to 40 years, the statement informs healthy baby born to COVID-19 positive woman at AIIMS. The Indian Express on its front page says, use homemade mask when stepping out, government. With a hope that the audio format could help create drugs that can counter the virus's effect, scientists write musical notation on virus protein, writes the Hindustan Times. The Mail today mentions about the two sisters from Jammu who, by composing Corona awareness song, are trying to spread awareness about the precautions to be taken in their unique own way. To beat COVID-19 blues, several shows like Ramayana, Mahabharat and Shaktiman are being re-telecast. Timeless classics for lockdown is the headline in the Pioneer. The Financial Express in its story titled World in the Web states, as the world stays home in lockdown mode, the internet is proving to be a lifesaver.
And now, before we end the special news program on COVID-19, the headlines once again. Nation to join Prime Minister Narendra Modi's call to light up diyas, candles at 9 p.m. today in collective resolve to fight COVID-19. Power Ministry says adequate arrangements in place to handle grid stability during the event. Government urges people to wear homemade masks when they step out their houses. Centre makes over 50 crore poor people eligible for free COVID-19 testing and treatment under Ayushman Bharat scheme. Restrictions imposed on exports of diagnostic kits to meet domestic need. More than 1 crore individuals download Arogya Setu mobile app to assess the risk of COVID-19. For details of these stories and more, log on to our website www.newsonair.com. And with that, we end the special news program on COVID-19.